So my name is Lee. The last name is Zheng. It's hard to pronounce. Acupuncture is an herbalist. So me and Dr. Fidel and Bonnie, we are together to show you some points on the hand, elbow, or knee, or neck to help you reduce the joint pain. And also, certain point around the joint can help you to boost the immune function. So because this is the flu season, right? This year the flu is so bad, and the vaccine only protects 10%, and the virus will be mutated pretty fast. So if we can do something for ourselves to strengthen the immune function, and at the meantime, because those points are around the joint, and then we can reduce the joint pain just by relaxing the muscle, improve the circulation, bring the energy to the joint. And that's the first part. And the second part, Dr. Fidel will show us to bring the energy to the part where you want to improve the energy flow and improve the function. So I'm going to just start at the acupressure points. So the wrist pain, how many people have the wrist pain? We can, yes, the wrist, not just for the wrist pain, but also can help you improve the digestion, because most of the points are related with the function of the gut, large intestine, small intestine, and also some elbow points can help you slow down your heartbeat and dilate the coronary artery. So if you press that, you can also enhance your heart function, because even though you have regular heartbeat, and the strength of the muscle is also very important. If it's a stronger contraction each beat, then you have more energy to do things, to run, to walk, to hike, go hiking. So that's what we want to focus on today. So first, if Bonnie, my close friend, and my video editor, put your hand like this, and I'm gonna put the different dots there. So the first one we're gonna do is, if you put your hand together like this, yeah? And then at the highest point, also in the middle of this second metacarpal bone, so this is the second metacarpal bone, in the middle, at the highest point. If you press that, it's very, very sore. And that's the one called the large intestine 4, which help different kind of pain, like headache, and lower the blood pressure, back pain. But if you do have low blood pressure like me, you gotta lie down, because it can lower your blood pressure too much, and you can feel a little lightheaded. And if you do have back pain, you lie down to press this, and you loosen up your back muscle. So that's the first one. And then we'll do another one if we put...
Can you all see okay, or do you want me to stand up?
Yeah, where is it, right here?
Maybe
Like-
stand up, you think?
Sure. Whatever's easier.
This is
So-
better?
Yeah, so it's right in here, like where you, it's kind of like a little peak area.
Yeah, that's the highest spot. No. That's the highest spot is right here.
Right there,
Yeah.
okay.
Yeah. So that's the first spot. And then we're gonna turn this side. If you flex your hand like this, you can see, we can turn this side, like flex your hand. You see that tendons there? Yeah? Yeah, you see this tendons, right? And then right on the wrist line, you can feel that indentation there. You press that, it's very sore. So this is another spot, and for the wrist pain. And it just generally opens up your energy flow to clear up the inflammation. So that's the triple warmer. It's also very important. So that's the second spot.
And you can feel it.
You can feel it's very sore. And you won't miss it, because otherwise you press the bone. You're just right next to the tendons on this side, on the small finger side. And then you turn this. You see there's a bone? If you do this way, you see the bone. And then just below this bone, and you see the white part, and you see the pink part. And right around here, this is also small intestine. So if we use a pink one, then that one also help the wrist pain. The other thing this one also can help is also the neck pain or back pain. So did you feel that? Just right next to the bone, at the end of this bone, metacarpal bone, the base, and then between the white part and the dark part or red part right here. So we have number 1, large intestine 4, the highest point, and try to lie down to press this if you don't have low blood pressure. And then go this way, put your hand like this, you see the tendons, next to tendons on the wrist line, and turn your hand like this way, and you have this spot. So this is small intestine 4 for back pain, neck pain, for wrist pain. And all of these 3 points can clearing up the heat inside of the body. It's the heat produce the inflammation. And it's the inflammation cause the joint pain and damage the tissue. And if the inflammation is not resolved for over 5 years, it could change your gene. And then that's why people get cancer. So anytime you have inflammation, you have to find a way to fix that. So that's the hand. And then let's go to the elbow. So the elbow we have, let's do this way. So flex your thumb like this. You see there are 2 tendons there, right? And right between these 2 tendons, there's another large intestine point, which called 5. You know this is 4, and this is 5. And this is another one for the wrist pain, and also for the function of the large intestine. And then we'll go to, you see there is the cubital crease. You see this crease? Elbow. At the end of this crease, you press that. It's very, very sore. So that's another very important point for the elbow pain, inflammation, and the function of large intestine. And also, we use that a lot to treat tendonitis or any kind of elbow pain. All right, now you're going to draw a line from large intestine 5, large intestine 11, so you draw a line in your mind. And then 3 fingers below on this line, that's the very important point. It's the 10, large intestine 10. So this point, when you press, you actually loosen up the muscles around the elbow joint. And then this one helps not only the elbow pain, but also the immune function. So this one, press that. It's right in the muscle, so you feel a lot of pressure and soreness. So that's the large intestine 10. So this whole line is large intestine. And then let's turn, I think we do this way. Or which way is better? This way, yeah. So if you want to turn a little bit, yeah. And see if you bend your elbow like this, and then there is the end of the crease, right? You see the cubital crease, the end, and then you see the bone. There is a bone here, not this one. There is a bone. Feel the bone here? Yeah. And draw a line between this bone and the end of the crease. In the middle, it's very sore here. In the middle, we have, this is called heart 3. So this is another elbow point on the heart channel. So the heart channel actually run this way. And this is on the wrist line, and there's another one, this is heart. So if you draw a line, this is the heart. So find the end of the crease here, yeah, the end of the crease, and then find out this bone. there's a bone mark here. And then you draw a line in the middle, is the heart 3. So press that, it's very, very sore. That can help to bring the energy to your heart. And then between this bone and the tip of the elbow, so you already find this bone, and then the tip of the elbow in the middle, that's another one called the small intestine. Actually, the pink one would be better. You see, we already get a small intestine 4 here for the wrist pain, right? And then we got another one right here. So you draw a line. So this is the small intestine. So the elbow, small intestine 8. Here is small intestine 4. So we have, let's review for the elbow. So you go this way, and you see the end of the cubital crest. And this is 1, large intestine 11. And draw a line, 5, 11, draw a line. 3 finger below on the line is the 10, which helping relax the muscle around there and also strengthen your immune function. And then turn this way and just lift your elbow like this. And then you will find the end of the cubital crest. And then the bone mark here in the middle. This one is the heart 3. And the heart 3 is for the heart function and elbow. And then turn this way. We already find this bone mark and already marked there. And then it's the tip of the elbow. Draw a line in the middle. That's another small intestine. So small intestine 4 and small intestine 8. So press that. It's very sore, right? All right.
And tell them how long to hold it for.
I think 1 minute should be long enough. You think 1 minute is too long? Yeah, and then you can alternate between 2 sides. If there's one side too much, I like to lie down to do those points, just because you can land your hand, elbow somewhere, so you don't hold for too long. So lying down is always good for me. And it's more relaxing for the back muscle. It's easier to bring the energy to the right place. All right.
Does that work on both arms? Or
Yes.
Oh.
So the channel is paired. And so when you do that, you alternate, so you don't have like soreness, so sore there. And so 30 seconds or 1 minute this side, 1 minute this. And then I also like to, you use thumb here, and then maybe you use like index finger here, and then middle finger here, so that you don't put too much pressure on one finger. Yeah, that way you create another pain. So, so just once you feel the pain, you stop there, because that means your body reached certain threshold.